variation in obesity, also at Oxford, which addresses the knowledge gap concerning social and cultural aspects of the emergence of obesity by conducting interdisciplinary research between the social and medical sciences. This unit is acknowledged in the Foresight Obesity System Map report as one of the select group of institutions capable of further developing the work in the report. There he and internationally renowned colleagues in the study of health inequalities, including Sir Michael Marmot, have developed and studied the welfare regime hypothesis, which is published in his work, his book in the Proceedings of the British Academy, Insecurity, Inequality, and Obesity Influence Society. And Stanley's been, his work has been a source of inspiration for me in my own work, and I'm very pleased to have him here. He's also a member of my stress special interest group, so it gives me great pleasure to welcome Stanley.
I might go longer because I'm so relaxed.
Right. We might forgive you if we're so relaxed.
Okay. Thank you for the previous session. Really good. Thank you. Okay, there's a lot of things I could talk about, but tasked with thinking about obesity, inequality, and insecurity. The structure of the talk, I'm going to consider both adult and childhood obesity, not overweight, but BMI more than 30, or the childhood equivalent of that. And what I'm going to do is hopefully start some thinking about the issues of inequality more globally. So, okay, this is far from local. In fact, I'm using global data, and the amount of data that I'm talking about in terms of adult and childhood obesity is in the region of about 16 million people. Okay, so to start off. Hands up if you know about this relationship, if you've seen something like this. At least 2 people, at least 5, 6 people. Okay, this is Kate Pickett's work on inequality and obesity. People might know the spirit level, in which they talk about the issues of inequality and obesity, and it shows the ratio of the top 20% and the bottom 20% in income among the industrialized nations. And it shows, you know, I've ring-marked 4 countries because I love talking about them: the United States, UK, Denmark, and Sweden. They also happen to be the kind of axis I seem to rotate around, if you will, including talking in all of those countries and having colleagues in those countries. Wilkinson and Pickett used international data to look at these issues of inequality. This is from Wilkinson and Pickett, and state data from the United States to show, well, in relation to a whole range of factors, inequality is bad for business. Okay, it's bad for business because people are less trusting, shorter life expectancy, higher mortality, higher obesity rates, higher rates of mental illness across countries, poorer education, higher teen birth rates, more homicides, more imprisonments, and less social mobility. So these issues of inequality and obesity are major. When it comes to children, similar things are there to be observed. Childhood well-being is less good among countries that are more unequal, and childhood overweight is higher in countries where there's inequality. That much we know. I'm going to focus on the idea of political interventions. Now, just since March, we've heard quite a bit about taxation on sugar-sweetened beverages. We've got a sense that taxation there works. We've got a sense that, from Mexico anyway, that taxation's reduced consumption of these things by about 6%. Since they've analysed data from 2013, Mexico was one of the first countries to introduce that. And the question about at what level should you intervene on obesity? There's evidence from Somerville that suggests that mid-level interventions don't reduce inequalities in childhood obesity. I'm talking about inequalities in childhood obesity. While you might have policies that guide choices through changing the default option, by enabling choice, providing information, monitoring and screening and all of these things, that might reduce overall obesity rates. And as we know in the United Kingdom, the rates of childhood obesity are declining steadily, slightly across the last few years, both at reception and at year 6 as people leave primary school. This is from the National Child Measurement Programme. The one thing that this data doesn't show is that it's the middle classes that are responding to all of these health messaging. That actually inequalities in childhood obesity rates are probably stable at the time that children go to school and then increase across the years they go to primary school. That should be counterintuitive to most of you because you think there's so many school programs to reduce childhood obesity that these differences should be declining, but it seems to be the opposite is happening. Okay, at the other end of the Nuffield Council on Bioethics intervention ladder, I've just applied this to obesity, is regulation by eliminating choice, excluding vending machines selling sugary drinks from schools, restricting choice so that you protect people by setting the limits of salt content of food, guiding choice through disincentives, taxation, in other words, taxation of unhealthy foods, and guiding choice through incentives, so through social welfare and general taxation. I'm going to concentrate on these two issues. I'm going to ask a question later on, which is, should we all be paying more tax? Who thinks we should pay more tax? I asked the same question in Stockholm. Do you know how many people put their hands up? How many people were happy? Who's happy with the level of tax they're paying? Few people, okay. What do you think the answer was in Stockholm?
A lot more.
Everybody put their hand up. 70% taxation, everybody put their hand up. They were happy with how much tax they were paying because they could see the social welfare benefits of taxation. Maternity leave, paternity leave, all kinds of ways in which they could see the state working for them. Now, of course, Sweden is not the UK. We don't trust our governments. We don't trust our governments with very much at the moment, to be honest. We don't even have a government at the moment. But the example of Brussels is that we could probably do without a government for a year and a half and still be okay, because Brussels, Belgium managed for a year and a half without a government. So we're not Scandinavian countries, but the issue of taxation is an interesting one, because it seems that taxation of sugar-sweetened beverages is something that we can do and intervene, and there seems to be general acceptance for it. And that mid-level interventions might reduce obesity, childhood obesity, but won't reduce inequalities in rates of childhood obesity. Okay, so the issue of taxation. What are the issues? We've done some work on welfare regimes, which I probably know a lot about, and social welfare and general taxation. Basically, there are 3 categories of welfare regime. We are here clearly Anglo-Saxon. We are into commodification. We want business to do well. When we target groups for social welfare, they're low-income households generally. We don't transfer much in the way of taxation across programs. We focus on means tests, and the primary focus in the country is on the market. Compared to Scandinavian countries, we're quite the opposite. If there's an intervention, it's the whole population that's targeted. The transfer is the highest possible, based on universalism, and the primary focus is on the state. So the comparison there is a very, 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 very clear one. And of course, countries can move across the two. The conservative countries are not conservative as we know them. They're conservative in as much as we would consider them traditional. So Italy, France, countries that maintain status-dependent transfers where they have somewhat in the middle. Italy, for example, it really doesn't matter, can I use a swear word, how badly the government fucks up. Because at the local level, regional governments are incredibly strong. So there's an awful lot of protection from the follies that might happen at the national level. So there are different systems, and we've argued and found that actually these regimes are important. These welfare state models involve varying levels of government spending on welfare, some high, some small, and there are different ways of looking at these welfare state models. One is actually the regime itself, but also how much money is spent in the taxation. When we did a large study looking at welfare regimes across country, we found that, yes, of course, food is important. The fact that food is cheap, energy-dense food is particularly cheap, than it has been since the 1960s. That certainly has something to do with the rise of obesity. Couldn't not. But it's less important, we found, than economic insecurity. And economic inequality was less important than economic insecurity. What is economic insecurity? Okay, how many of you in this room are on short-term contracts? Okay, not me, I'm permanent. Okay, the people we've been with your hands up will probably have a good education, probably have a decent standard of living, but you could lose your job. That's an insecurity. That's a level of insecurity that could contribute to obesity. Economic insecurity can be of different kinds. Skill insecurity, that is, you, sir, you lose your job. Once you've lost your job, can you get another one very easily? Don't know. Hope so, of course. Okay, I'm sorry to put you on the spot. But if you have an education, you have a training and flexibility of mind, then you can say, well, okay, I can't get a job here, the market's dried up, I'm going to retrain, I'm going to do something else, I'm going to reconfigure my position in the marketplace. So that's what skills insecurity is. That is, you're able, if you have some level of education, you're able to reconfigure yourself in the marketplace. Representation insecurity. Who belongs to a union in this room? Okay, a small number, but just over half. I'd expect more, to be perfectly honest. You have representation security. That is, if your employer treats you badly, and treats you en masse badly, then you have the possibility of representation through a third party that has collectively more power than you have individually. That is important. If your employer says, look, keeps you on a knife edge all the time, you're not unionized, there's nothing you can do, you say, well, at any moment they could sack me, but I'm just hanging in there. The day-to-day stresses of just hanging in there are much, much greater than if you have representation security. Then income security. These are the most important things. There are other insecurities that are also fundamentally important. That is health insecurity and unemployment insecurity. If the state can provide health security, this is one of the major contributors to obesity. Employment insecurity, also a major contributor to obesity. The mechanism through stress, comfort eating, self-medication through food and so on. All of that literature is now pretty firmly in place. So these issues, in the United States, Obamacare isn't just about health. It wasn't just about health. It's about the state of the nation, that's health of the nation. But actually, there are so many bankruptcies in the United States that are related to somebody becoming ill and then just losing everything because they don't have health insurance. So the National Health Service is something to die for, literally die for, because it is so much more than about health. And that's one thing the British population en masse has got right, very firmly right. It is fundamentally important. Okay, so what we've shown, patterns of adult obesity vary by socioeconomic status and levels of inequality between and within high-income countries. We know that. We know that patterns of adult obesity vary by welfare insecurity between high-income countries. What about childhood obesity? Don't know. We also don't know that if taxation is a good thing, if it's cat and baby, does high levels of government spending ameliorate obesity? That is, the countries that spend more on you, take more of your money and spend it for social welfare, does that ameliorate obesity levels? So that's the question we're going to look at. The data in terms of inequality, the Gini coefficient, which is looking at income inequality within countries, in high-income countries. And I should note here, high-income countries, we usually say, oh, it's that, and it's that, and it's that, okay? Australia, United States, Canada, Western Europe, Japan and South Korea. That's the usual reading of high-income countries. Go look at the World Bank classifications of high-income countries. Actually, there's also the Middle East. There's also countries in Latin America, like Venezuela, like Brazil, like Argentina, that now are classified as high-income countries. This thing is a shifting thing, and we're being very ethnocentric if we say we're just considering the European countries as being the high-income countries. That's not true anymore. This has shifted just in the last 10 years and will continue to do so. So we need to do these analyses of inequality across a shifting time frame as economic prosperity starts to kick in more and more countries. Note one thing, that in the Middle Eastern countries, most of them don't report on income inequality. They report on many other things, but they don't report on income inequality. Government expenditure as a percentage of gross domestic product is another way of looking at how insecurity rather than welfare regimes, because welfare regimes are a slippery thing. You know, you could say we had a Labour government that was a bit more welfare oriented, and then we had a Liberal Democrat coalition, and now there's a Conservative. Is there a Conservative government? Who's in power? No idea. Boris Johnson. Scream. Hateful man. Hateful man. He may be very funny, but he's hateful. Do not elect him Prime Minister if you have the power to stop him. His jokes mask a lot of nastiness, please. The government expenditure as a percentage of GDP is something that is monitored every year, as opposed to regimes that roll over all the time. You could actually have a conservative government that is spending a lot on welfare, for example, but this allows a more fine-grained analysis, again, in the same sets of countries. Obesity from the World Obesity Federation, lots and lots of data. This is children, males, females, also adult obesity we have. And then we have the analysis. We end up with 33 World Bank high-income countries. Data average for the period of 2005 to 15. Obesity from the World Federation of Obesity database. World Bank data on gross domestic product. Economic inequality. Government expenditures percentage of GDP. And then national dietary energy availability. That's important because almost everywhere dietary energy intakes have been increasing. And so you need to be able to control for that because it still varies a lot across different countries. Okay, there are 56 countries which have charted obesity data. It's 80 high-income countries altogether. So immediately there are a lot of countries that don't have data on childhood obesity. We think we know a lot, we think we've got a lot of data, but actually there's huge gaps in the data that we have. So many high-income countries don't collect data on childhood obesity. When we take the data on inequality, income inequality, and data on percentage spent on social welfare, then we end up with 33 countries altogether. So it ends up being a small number. Okay, what about energy intake? Obesity emerges in the context of increased energy availability, and this is data across these 33 different countries. The UK sits here somewhere in the middle, very, 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 very slightly rising, not very much. And the argument is that actually much of the obesity in the UK has come from declining physical activity, much more so than from increased energy intake, as opposed to the United States, where much more has come from increased energy intake rather than declining physical activity. This chart shows food prices and how they've declined since the 1980s. And they declined to a low at about 2007, and then suddenly everything went belly up with the financial crisis, and they've been jumping around all over the place ever since food has become increasingly commoditized on the global markets. So to the data itself, let's return to Wilkinson and Pickett's argument about inequality and obesity. Let's just revisit it with these 33 high-income countries. reworking of Pickett-Dale's correlation. What does it look like for these 33 high-income countries? Well, for women, it's still there, but only just. In fact, you know, the relationship is not like that anymore. It's a much, much flatter relationship if we take those particular countries. When we look at men, relationship gone. It's not there at all. So the issue of how we look at inequality and obesity across countries is important. We need to be thinking about the countries that are entering these categories and their particular levels of inequality. When we look at children, the relationship, sort of meeting that there were a number of bariatric surgeries and they were happy with probabilities of 0.1 as being statistically significant. So I'm happy to go with that if they agree with that. Regardless of say there's a weak positive relationship between overweight and obesity and income inequality for male children. The same is true for female children. So the relationships between inequality and obesity seem to operate perhaps slightly more strongly for children than for adults. So to dig a bit deeper, if you're not into regressions and statistical, you know, correlations and probabilities and all the rest of it, just to have a few mindful moments, do a bit of tapping, close your minds, and we'll come back to this very shortly when I show you when I say cartoon, you can open your eyes again. Okay? So please feel free. Okay, this is a regression analysis of inequality in relation to obesity, controlling for daily energy availability. Okay, so this is a more precise way of doing those correlations. The stuff in pink is the stuff that pops out as being meaningful in some way, and the numbers that are important, the numbers down at the bottom. What it shows is that the relationship between obesity and inequality, once it's controlled for dietary energy availability, stays there for children, both males and females, not there for adult males and females. So, cartoon. The relationship between inequality persists for male children, female children, not for adult males and not for adult females. So that's one set of relationships. Okay. Now, when we twist our arms a little bit and start to look at this in a bit more detail, I've created something that I feel I ought to call pseudo-families. You can't actually analyze families at this level, but what you can do is look at the relationships between obesity in adult males, adult females, and male children and female children. Because one of the issues in trying to understand obesity is that in some countries, very high levels of adult obesity, low levels of childhood obesity. Other countries, low levels of adult obesity and high levels of child obesity. Italy's a good case in that respect, for example. High levels of childhood obesity, low levels of adult obesity. So what the parents do is not necessarily parent obesity is not necessarily directly connected to childhood obesity. There are weak links, but I stress that they are weak links and they vary from place to place. Okay, we look at this. Again, relating inequality to these, as I put it, pseudo-families. Inequality is related to adult obesity, male and female, but it's not, when you include children, but it doesn't happen when you exclude the children. So it's clearly something that's happening among all of those, adults and children. It's not just an adult thing, it's not just a child thing, it's a set of relationships. And what pops out when we look at the next set of squares, when we just look at adult males and females, and children, males and females separately, there's no relationship with inequality. The relationship starts to pop out here when there's a relationship that we put into the equation: inequality, daily energy availability, adult male obesity, child male obesity. There's a relationship. Adult male obesity, adult male obesity, and female child obesity. There's a relationship. Adult females, female child, a relationship. Adult females, male children, there's a relationship. So there are links between this structure. We cannot really be thinking about adult male, adult female obesity as being separate things. They're actually all networked, if we can say that. Okay, so to this cartoon, when we look at the relationships between inequality and obesity, first of all, there's a relationship between inequality in adult male and adult female obesity. That relationship disappears, but then that's mediated in children through adult males and females. So there are probably familial effects in this, but of course we haven't been able to pull out familial effects from the kind of data that we have. The next thing that we need to control for is family size, marriage rates, divorce rates, and so on. That's the other thing that needs to be incorporated into this data to be able to tighten it up. Okay, let's put insecurity into this. Okay, economic inequality and economic insecurity, they're overlapping terms. Economic inequality is variation between people or populations in their incomes and assets. Economic insecurity is likely solvency of a personal population into the future, according to continued employment, welfare provision, savings, pension, and so on. So it's very much a projection into the future. Will I be able to carry on my life as I live it now, or is there something that's getting in the way of that? As I've already said, insecurity can cut across socioeconomic position. This is for the United States, and it just shows unemployment rates from the 1970s all the way to the economic crash, where at this point, blue-collar workers, service workers, and white-collar workers all experience huge increases in inequality. But these white-collar workers are not immune from losing their jobs. I'm never happier than when I see an unemployed banker, but that's an aside. Insecurity cuts across socioeconomic positions, so it's not something that operates quite in the same way as inequality. How does it operate through countries? We can again take our comparison of Nordic countries, low inequality, high welfare provision. So this shows Gini coefficients in the Nordic countries, and these are the countries that we know and love: the United Kingdom, United States, Ireland, Australia, the Anglo-Saxon countries. Higher levels of economic inequality, much lower levels of welfare provision. They do stratify. They rarely cross over. Taxation is an important instrument for reducing inequality in Nordic countries. Okay, take a look at this. This is the level of inequality. Denmark, Sweden, UK, United States. I can say this is a bit higher here than it is in the Nordic countries. But after taxation, this level of inequality drops to about by about 40% relative to the UK and the United States. Taxation really is a major instrument of flattening out society in the Nordic countries relative to the Anglo-Saxon countries. Forcing you to think about tax. Okay, it increases security, social, medical, employment, income, pensions, all of these things. On the one hand, it reduces inequality and increases security. And I think if it's a perfect system, you would expect your taxation to work for you, and therefore you'd expect to get back everything you put into it. So there should be a perfect relationship. Not only does it reduce inequality, but what inequality is left there should be further reduced by what the taxation does for you. Well, the truth is, it doesn't really. It does to the extent of about a third, maybe just over a third. This chart shows the 33 countries again, government spending as a percentage of gross domestic product, inequality as Gini coefficient. That's what you would expect, and that's what you actually get. Yeah, it only partially reduces economic inequality. It's significant, but it only partially reduces economic inequality. That's what you would expect. So, here's the question: should overall higher government expenditure reduce social and economic insecurity, and through that indirectly obesity? So the thought experiment is, if you pay more tax and you trust your government to spend your money wisely, it should make life less stressful. How much?
5.
5. Okay, I've got my reading glasses on, so I can't see. It should reduce levels of stress, and therefore indirectly reduce levels of obesity. Okay, back to some more of these charts very briefly. This one looks at obesity, putting in inequality and levels of security. And we can see that when you put security into the equation, inequality still features hugely. That is, government spending doesn't do a hugely effective job in reducing, being related to inequality levels as associated to levels of insecurity. Would government spending ameliorate economic inequality in relation to obesity? The government expenditure reduces inequality, but childhood obesity rates are still related to inequality. That is, childhood obesity rates remain related to inequality, adult obesity rates do not. Okay, come to the bottom line very, very quickly. When we take government expenditure out of it, then the relationship between inequality and obesity is strengthened, which is the Wilkinson and Pickett finding. But there is a mediation that's happening through there, through government expenditure. So it's mediated. When we go back to the same picture again, does the relationship between inequality and obesity reduce through government spending? Well, no, but it enhances the relationship between adult and childhood obesity. So very, very, very briefly, the same relationships that were shown between, adult male, adult child, male child, adult male, female child, adult female, female child, male child, etc., is there, but the relationship is strengthened when you put all of that together. So, to the cartoon, which summarizes, I hope, everything before I get onto a few frivolous slides. Insecurity contributes to inequality. Inequality contributes to adult male and female obesity, and adult male and female obesity is then a mediator of obesity in male children and female children. So a whole set of relationships is there. Inequality is important, but an overarching framing that links all of this is levels of insecurity. So, cautious conclusions. Of course, we'd like stronger data, but you can't actually create national level data just like that. You have to take what's there. Patterns of childhood obesity also vary by socioeconomic status and levels of inequality between and within countries. It's mediated through adults. Could this be a proxy for parents? Inequality in childhood obesity is not ameliorated by welfare security. Government spending accounts for about 30% of variation in inequality, so there should be some scope for amelioration of obesity rates through government spending. This study shows no such effect, but enhances the relationship between adult and childhood obesity. So, in summary, politics do matter for obesity. This is a little something that I hope will be out in time for the American election, which shows percentage rates of obesity in Republican states and Democrat states in the United States. There is a difference. Who you vote for matters. European referendum. This is how the vote went. This is the train line between London and Oxford. This is the train line between London and Cambridge. You can see this is, it's pretty obvious that we should be declaring independence, but with Scotland. And Durham's up here, of course.
Newcastle.
Sorry?
Newcastle.
Newcastle.
Yes.
Newcastle.
Newcastle's the only one in the north.
Okay. E-referendum, does it matter? Well, probably does. What are the potential impacts if all of this goes ahead? What are the potential impacts of English isolation and rates of obesity and obesity inequality? I would suggest that now is the time to actually start collecting data, because I would predict that inequalities and obesity rates should start to be jumping up within a year of signing Article 50, whatever it's called. Something to worry about. It does matter, these things do structure. Okay, I've been asked to talk about policy and my policy involvement, and I haven't very much, I'm sorry, here I am. I've been involved in the UK foresight obesity since 2010, when it was more or less killed by the coalition government. So we talk about obesity complexities that was constructed through foresight obesities. Present government not interested in complexity, let's say. So regional regionally, you can talk about it, but the national government is interested in responsibility deals. That's what, except for the one thing, which was sugar taxation, which actually went under the radar because that didn't. It was one Public Health England document, and it didn't go through the usual process of policy consultation before it was announced in the budget. Slipped through, so it was a George Osborne initiative, and that kind of thing happens. All the policy work you could do in the world doesn't stop a treasurer having a particular opinion. In this case, a good one, I think. Okay, I've been involved in Danish Parliament welfare state debates up until 2015. It wasn't about obesity, it was about what are the impacts of dismantling aspects of the welfare state. Because all Scandinavian countries are saying, this costs a lot of money to keep all this stuff going. And right now, 2015 was Denmark now has a populist right-wing government, which is doing some astonishingly scandalous things, but the important thing is to hang in with what they do. So the attention shifted to the municipality of Copenhagen, which remains a kind of Berkeley-esque, Cambridge, Massachusetts-esque kind of independent state in the middle of a right-wing populist nation that is still able to do very amazing things in terms of, and has a significant population. I was involved in the Commission on Ending Childhood Obesity, which the report just came out just recently with the World Health Organization. So that was a paper that came out on pediatric obesity. That was one of the things that was part of that consultation on inequality in childhood obesity. The end.